Okay, good morning, good night. For some people, it's really, really early morning. So excited to have everybody here today. My name is Dr. Ranit Mishori, and I'm Senior Medical Advisor at Physicians for Human Rights. And thank you for joining us wherever you may be. In October 2017, I arrived with a Physicians for Human Rights colleague in Cox's Bazar in Bangladesh. Our mission was to figure out what steps we needed to take to initiate a human rights investigation and document atrocities against Rohingya refugees that at the time were still pouring in across the border from Myanmar. I remember driving through some of the camps thinking to myself, how can anyone really capture the voices and testimonies of people fleeing here? The catchment area was simply enormous. There was chaos. There were lots and lots of people. What happens often in humanitarian emergencies like that, when you have to deal with basic necessities, shelter, food, water, sanitation, safety, is that human rights issues often fall to the wayside. But at PHR, we knew we had to figure out a way to tell the world about the Rohingya and why they had to flee to Bangladesh. We've been doing this for more than a decade. For over 15 years, PHR has been reporting on the scale and severity of abuses committed in Myanmar, documenting grave and systematic human rights violations, including religious persecution, arbitrary arrests, sexual and various other forms of violence. Most recently, our work followed a violent August 2017 crackdown by the Myanmar military in northern Rakhine State, which killed thousands and drove more than 720,000 people into neighboring Bangladesh, creating what I could see at the time with my own eyes, the world's largest refugee camp. Our subsequent PHR visits included experts that were able to conduct forensic evaluations of survivors to collect firsthand witness accounts of what had happened to them back in Myanmar. This work resulted in several reports about human rights abuses suffered by the Rohingya that I think we're going to add to the chat in a little bit. But given the magnitude of the influx and the magnitude of the human rights violations, and as advocates and several governments continue to press for accountability, now 3 years later, more stories needed to be told and testimonies needed to be corroborated. So at PHR, we wanted to offer additional documentation of human rights violations and the conditions Rohingya survivors found themselves in Cox's Bazar and elsewhere, with a specific focus on sexual violence. It's a focus area within PHR and the program on sexual violence in conflict zones. We wanted to continue to probe, but also mindful of the effects of trauma on survivors, to do that in the least invasive and harmful way. The best way we determined was through interviews with healthcare professionals who took care of Rohingya men, women, and children in the refugee camps in Cox's Bazar. Healthcare professionals, after all, have a unique point of view. They routinely hear personal stories, even the most difficult ones that members of other professionals seldom do. And they're often the first helpers whose expertise survivors seek out. Through interviews with doctors, nurses, mental health experts, and other healthcare professionals, we continue to tell the stories of the Rohingya and build upon existing evidence and the enormous physical and psychological toll of sexual and gender-based violence. So today we are very honored to present our newest report, Sexual Violence, Trauma, and Neglect, Observations of Healthcare Providers Treating Rohingya Refugee Survivors in Refugee Camps in Bangladesh. And I'm joined by a panel of experts in human rights, international law, and advocacy to discuss the key findings of our new report and recommendations. Leading today's presentation is my colleague, my friend, Lindsay Green. She's Senior Program Coordinator for PHR's Program on Sexual Violence in Conflict Zones and co-author of the report. Lindsay has been a leading force in PHR's research on sexual violence in general and other human rights violations perpetrated specifically against the Rohingya. Lindsay, I turn it over to you.
Thank you very much for the introduction, Ranit. It's my pleasure to share the main findings of our report, Sexual Violence, Trauma, and Neglect, today. Before we discuss the specific aims, methods, findings, and conclusions of the research that contributed to this report, I wanted to spend a moment to review the events that led to the mass movement of Rohingya refugees from Myanmar to Bangladesh in 2017. The Rohingya are a Muslim minority in Myanmar who have faced persecution for decades. This has included restrictions on movement, denial of the right to health and education, and denial of citizenship, among other abuses. Following alleged attacks in 2016 and 2017 by the Arakan Rohingya Salvation Army, a Rohingya insurgent group, the Myanmar security forces, known as the Tatmadaw, and local Buddhist civilians launched clearance operations in northern Rakhine State, which were, in the words of the 2018 United Nations Fact-Finding Mission report, immediate, brutal, and grossly disproportionate. These clearance operations forced over 720,000 Rohingya to flee neighboring Bangladesh, where they now live in 35 refugee camps in the region of Cox's Bazar. PHR has been documenting human rights violations against the Rohingya and other ethnic minorities in Myanmar for over a decade. In 2017 and 2018, PHR conducted research to document the experiences of Rohingya refugees who had fled to Bangladesh. A survey with Rohingya hamlet leaders, qualitative interviews, and forensic evaluations found that violence and human rights violations were widespread and systematic in Rohingya communities between June and September 2017. On the topic of sexual violence specifically, which is the focus of this report, studies documented that sexual violence was deployed as a deliberate, targeted strategy used by the Tatmadaw against the Rohingya civilian population in order to intimidate, terrorize, and punish them, and forcibly displace the Rohingya from their land. Rape and gang rape, mass rape, sexual assault, followed by the killing of victims, and forced witnessing of sexual violence were patterns of perpetration documented by UN investigators, human rights and humanitarian organizations, and journalists, among others. Building on PHR's past research and other documentation, this study sought to document injuries and conditions of Rohingya refugees seen in Bangladesh after August 2017, with a specific focus on sexual violence, through speaking with healthcare workers who had provided them care in refugee camps. In addition to documenting physical and psychological signs of sexual violence, this research sought to identify barriers and facilitators to delivering care to Rohingya refugees in Bangladesh, and barriers and facilitators to evaluating and documenting human rights abuses. To meet these research aims, we conducted one-on-one semi-structured interviews with 26 healthcare workers working for a variety of humanitarian organizations who provided direct services to Rohingya refugees in Bangladesh for some period between August 2017 and August 2020. For the purposes of this research, healthcare providers were defined broadly to include physicians, nurses, midwives, community healthcare workers, mental health and psychosocial support workers, case managers, and health volunteers. Data was collected in 2 phases between November 2019 and August 2020 by a research team of American and Bangladeshi social scientists and physicians. Few studies have documented the experience of Rohingya refugees through the lens of people who cared for them in Bangladesh, and PHR believes that healthcare workers have unique and important perspectives to offer. In Bangladesh and beyond, healthcare workers are often the first people to whom survivors may consider disclosing their trauma and intimate details of their experiences. Interviewing them enables the systematic collection of survivor and witness accounts while protecting patient privacy and avoiding potentially re-traumatizing survivors. And this concern is paramount with the Rohingya, who have often had to tell and retell accounts of atrocities to numerous officials, researchers, aid workers, and journalists over the years. Furthermore, healthcare workers are able to speak to individual patient stories and also broader patterns and trends they observe in their patient population. We can assume that each of the healthcare providers interviewed for this study provided care to hundreds, if not thousands, of Rohingya refugees. PHR sought the perspective of healthcare workers in order to provide an independent corroboration of the patterns of violence sustained by the Rohingya community. The findings of this report are broken into 2 categories: survivor experiences and survivors' interactions with the humanitarian system in Bangladesh. I will review some of our key findings within both categories, starting with survivor experiences. The quotes in the following slides are from the healthcare workers who we interviewed for this study. I will pause as I go through the slides, or I'll try to ensure that you have time to read the questions, or the quotations, sorry. Healthcare professionals universally recounted seeing signs and consequences of sexual violence perpetrated by members of the Myanmar military and security forces. Patterns of sexual violence included gang rape, mass rape, and sexual violence accompanied by other violent acts, including beatings, killings, and destruction of property. Forced witnessing of sexual violence against family or community members was also shared as a common tactic used. The patterns and perpetrators described by healthcare workers interviewed by PHR are consistent with many other reports. It is also important to note the perpetration of sexual violence was not limited to women and girls. Health workers also shared stories of providing care to non-female identified patients, including men and boys, and third gender and transgender individuals. These survivors were often very reluctant to disclose their experiences. As illustrated in this quote, healthcare providers shared that sexual violence was often revealed during provision of care for other reasons, including pregnancy-related care, mental health care, or in addressing psychosomatic complaints, for example, muscle pain, backache, or a headache with no known cause. Healthcare workers shared that many of the survivors exhibited signs of mental health conditions, such as depression and PTSD. Some patients were able to verbalize their traumatic experiences, while many others were reluctant to express their feelings, a perspective captured in this quotation. As time went on, healthcare providers shared that they began to hear stories about and see evidence of intimate partner violence perpetrated by Rohingya men. These incidents were often attributed to the trauma of violence experienced in Myanmar and stress related to life in the camps. Turning to the survivors' interaction with the humanitarian system, it is important to note that in August 2017, when Rohingya refugees began to arrive in Cox's Bazar, they found an environment that was not prepared to accommodate them. The Bangladeshi government and international organizations were racing to mobilize an emergency humanitarian response, but the existing infrastructure was inadequate to handle the arrival of such a large number of people. Rohingya survivors faced challenges in accessing services due to a chaotic care environment, especially at the beginning of the humanitarian response. At that time, life-saving care and provision of necessities was prioritized, meaning that mental health and non-acute physical health problems were left unattended. Health centers and posts were staffed with a mix of Bangladeshi and international healthcare professionals serving in short and long-term positions, some of which were volunteer response positions. Healthcare workers who PHR interviewed reported that their workload and lack of physical infrastructure to provide privacy during patient consultations made it very difficult to provide trauma-informed care to survivors of sexual violence. In addition to challenges due to workload and lack of privacy, healthcare workers shared that it was difficult to build rapport with patients. This was attributed to communication barriers, which necessitated working with translators, the absence of Rohingya health workers or support staff, and cultural barriers that made it difficult to connect with patients. Sensitivities around the interactions between males and females and expectations of modesty were key elements to providing culturally appropriate care. For example, if the gender dynamics in the exam room were not culturally appropriate, the patient might not disclose important information or deliver complete history, as this quote mentions. Respondents shared stories where the workload and staffing at health centers did not make it possible to observe cultural best practices. And in those cases, they felt that they had not provided adequate care. Furthermore, female survivors were reluctant to discuss and disclose sexual and gender-based violence that occurred in Myanmar due to stigma and fear that they would be rejected or blamed by their family and community. Despite these barriers and challenges, as the stories shared with us show, In many cases, survivors chose to disclose their experience to healthcare workers whom they trusted. Healthcare workers who PHR interviewed for this research also shared that resources to provide care to patients, especially comprehensive mental health care, was incredibly limited. Limited resources combined with inconsistent screening protocols and referral pathways that were not always clear created further barriers for survivors to access services and document human rights violations. Finally, as this quote illustrates, the Rohingyas' ongoing lack of status as refugees in Bangladesh further complicates their ability to access services and restricts their movement. Based on PHR's findings, we can draw a few key conclusions. First, sexual violence was widespread and committed against Rohingya women, girls, men, boys, third gender, and transgender people. Survivors of sexual violence did not often report their experiences and faced strong cultural pressure and stigma to remain silent. Because of this, there are potentially many survivors who have not sought care and have an unmet need for post-rape and post-violence services. Consistent with this finding, healthcare workers described the Rohingya as a population with vast unmet needs for mental health support. Based on clinician observations, the Rohingya have experienced repeated trauma, from the initial acts of sexual violence in Myanmar, through their flight and arduous journey to Bangladesh, to their lack of access to appropriate medical care or psychosocial and mental health support upon arrival in Bangladesh. This has delayed healing and compounded trauma. The findings of this report, specifically regarding the scale, brutality, and patterns of sexual violence experienced by the Rohingya in Myanmar, the ongoing experiences of intimate partner violence experienced in Bangladesh, and the severe barriers to care, demand concerted action at the national, regional, and international level. Based on the findings and conclusions laid out in this report, Physicians for Human Rights has some key recommendations and calls to action. These focus on justice and accountability and survivor-centered approaches. There are several processes ongoing at the international level that seek justice and accountability for serious crimes committed against the Rohingya, which Akila will provide more information about shortly. In addition to prompt, independent, and impartial investigations into all allegations of grave human rights violations by the government of Myanmar, justice requires formal acknowledgement of the scale and severity of crimes, including sexual violence committed against the Rohingya by the Tatmadaw and other security forces. Any voluntary, safe, and dignified repatriation to Myanmar must be premised upon guarantees of basic rights to which Rohingya are entitled, including guarantees of citizenship by the government of Myanmar. The government of Bangladesh should also work to ensure that Rohingya refugees have access to legal protections, legal status, and official documentation as refugees. Alongside international justice and accountability efforts, a survivor-centered approach prioritizes the needs and perspectives of Rohingya survivors and their communities. Addressing barriers to care requires action on the part of civil society organizations and the Bangladeshi government. This includes investigating and prosecuting intimate partner violence and other forms of sexual violence committed against the Rohingya while in Bangladesh. Additionally, the international community should support a survivor-centered approach within judicial process. Finally, this report would not have been possible without the efforts and support of many people to whom we would like to extend our thanks, particularly to the healthcare workers who shared their stories and experiences with PHR. Thank you so very much for giving us your time. Thank you very much. I'll pass it back to Ranit.
Thank you so much, Lindsay, and thank you for presenting the findings, but also for your immense leadership in getting this research off the ground, and you and Tom McHale. So appreciate that. What I'd like to do now is to turn to our panelists. Their collective experience and expertise is incredible, and I will describe them, and then we can start with some questions. First, I think she's right now in Dhaka, Bangladesh. Shanur Chowdhury. She is a gender rights activist based in Bangladesh and has 20 years of experience in the development sector. She specializes in gender and inclusion, protection, sexual and reproductive health and rights, and women's leadership and empowerment. She is a co-author of the report, and we're very lucky to call her a PHR consultant. We also have with us from New York City, Akila Radhakrishnan. She is president of the Global Justice Center, a nonprofit that works to define, establish, and protect human rights and gender equity by enforcing international laws that safeguard human rights and promote gender equality. She has provided legal expertise to domestic and international stakeholders and policymakers, including the International Criminal Court, the United Nations, the European Union, and world governments. And lastly, we have Yasmin Ullah, who is talking to us today from Vancouver in Canada. She is a Rohingya social justice activist born in Northern Rakhine State in Myanmar. She formerly served as president of the Rohingya Human Rights Network, which is a nonprofit comprised of activists from across Canada advocating and raising public awareness of the Rohingya genocide. So I think I would like to start with Yasmin this morning as an activist and a member of the Rohingya community. Does this report help address issues faced by the community either in Bangladesh or elsewhere?
Certainly, it totally, one of the things that it does is it validates our experiences, and not necessarily the individual experiences of the women who've actually undergone sexual and gender-based violence that are, very, very much out there and extremely, clear. But it's the communal experience of the people who've had to witness their family members undergoing those such, heinous crimes that were perpetrated against them, as well as the communal effects that it has on the community as a whole. It sort of crippled the ability to move past the traumatized self or the traumatized identity, or what's actually called a traumatized existence, which is not something that is easily erased or extinguished, or something that we could work out the solution very, very easily. It is obviously, first of all, I would have to thank PHR for actually having done such a great job of actually researching this and preventing people from being re-traumatized and re-victimized over and over with them having to recount the story. It's not an approach that I see very often, and I hope that other people who are watching this will take note. One of the things that I also see is that sexual and gender-based violence that Rohingya women experience and continue to live through, this agonizing effects and the traumatized existence, are not just something that's unique to or something that's completely new to the world. It's actually a pattern that's very much communal among the women within the Myanmar ethnic nationalities as well, by the same perpetrators. And women worldwide in the war-torn zones, in the war-torn areas, as well as the groups that have gone through, or being subjected to mass violence or mass atrocities, also seem to have experienced similar, sexual and gender-based violence. It could be in various different forms, but this was exactly the reason why the term genocidal rape exists. The intention is very clear. It is carried out to instill the fear within the women within the community who are, with the patriarchal gender role, being assigned to be the nurturer and the caregiver of the community, of not just the family, but also the community as a whole. And this is basically an act of torture after, not just the women themselves, but also their families having to witness their other family members being killed and continue to have to be traumatized and tortured in this way. It severed the ties within the community. It destabilized some of those ties. It really destroy the foundation of what makes the community works in general. And so this was, a tool that the military, many fascist government and many authoritarian governments have actually used in order to basically disrupt the bloodlines, as well as disrupt a way in which a community can actually recover. And just as Lindsay had actually summarized for us, the insufficient or the lack of psychosocial and mental support, mental health support, is actually a debilitating factor into why people are not going to be able to move on from this, as well as if they were, to be part of others, community outside of, apart from that, region. And so a lot of people that I've spoken to, unfortunately, just as I visited in February this year, it seemed like a long time ago, but a lot of those people had actually mentioned that their ability to envision their lives outside of being a refugee or outside of living inside the camps in the restriction, in the destitute conditions they're living in, they cannot do that anymore. And it's slowly incapacitating their ability to try and get out of those conditions. And we have seen that in the past 3 weeks, the effects of the repressed lack of support, lack of mental health support, and the repressed memory and the unprocessed emotions have actually transpired into something else that is really, really difficult to control. And various different government entities are not just not willing, but they're not ready to face the reality that is the effect directly from the genocide, from the tortures, from the various different crimes that were perpetrated against Rohingya. So this is one part of it, that Rohingya continue to live in genocide, even though they're removed from the geographic location that took place. Now, the science also supported that the trauma that we've experienced as a whole or as individual does not just cause us to have depression, anxiety, PTSD, hypertension, or just those health conditions, mental or physical. It also extends to changing and altering our brain forever. It also actually makes some, it changes the ways in which our epigenetics work, and it continue to get passed down to the next generations. I worry about the people inside the camps right now, but I also worry about the next few generations of the people who will carry that trauma within them without knowing why. And so this report has done a lot of highlighting, this experience as broadly as it could, and it really helped not just validating our experience, but also perhaps in the future, be basically a groundwork for some more studies to be done on this, specifically on the Rohingya women.
Thank you, Yasmin. I appreciate your focus on the pervasive impact of sexual violence and violence in general, and the trauma, as you said, from the very cellular level to the individual and to communities and even to next generation. So thank you for bringing that up. I want to take the next question to Shanur. As a member of our research team, and you're a gender expert as well, were there any stories and experiences that were shared with you by healthcare professionals during the interviews that resonated specifically with you, related to conditions related to past trauma?
Thank you very much, Ronit. And it has been a great opportunity for me to be involved in this research team and in this research on sexual violence. And as you know that I have been working with the Rohingya community very closely since 2017, with two international organizations and working in the areas of gender-based violence, as well as protection-related works. And given my experience, working in this field, as well as working with the Rohingya community, the findings that we have, or the stories that we hear from the health professionals of this wide range of service providers, my experience echo with theirs. Like, firstly, if I talk about, when the Rohingya people, their experience of trauma and violence was very difficult. And we can also see this in the general population, like, for many reasons, they are not, their experiences, like stigma around experience of violence. There were cultural issues, cultural barriers, there were language barriers. We don't speak the language of theirs. And sometimes we need to, seek support from the translators, where Lindsay mentioned earlier that, there were gender dynamics played an important role there. And also in the beginning, like, as I said, that not all the healthcare providers were aware of, survivor-centered approach, or they were not all gender sensitive, because in the beginning we had to rush to provide the services, and along the way we developed those, SOPs and approaches, and we oriented those stuff. And secondly, globally we know that women and girls are, bear the most burden of violence. But we must not forget the fact that men and boys, transgender population, as well as gender fluid population, are also, experiencing violence. They experience violence in Myanmar. They are also experiencing violence, particularly sexual violence, even in this country. And these protection-related services, or survivor-centered services, are mostly focused on women and girls. But we know and understand the needs of, boys and men and other, persons from different gender orientations or sexual orientations. And there are organizations who are now providing services to, to those populations. And very interestingly, sometimes they are in disguise of, providing services to men and boys, like those transgender population or gender fluid population. They come to the centers where, men and boys receive services, and from them, the providers provide the necessary services to them. But we need to focus more on these groups. And then lastly, I'd say that, in the beginning, there was like, the referral mechanism was not very smooth, and there were overlaps between organizations who provide which services. But over the years, this has been systematized, but I would still say that this is not universally, followed. And they need to work more on the referral mechanisms, like, because most of the healthcare providers, for instance, they don't provide SGBV services. In many cases, they have to refer those patients or clients to the specific SGBV service providers. And finally, like, we have passed 3 years, and like, from my experience working with them since the beginning until now, the pattern of violence, the pattern of sexual and gender-based violence has been changing. And like, for instance, now intimate partner violence, domestic violence, and other forms of violence, like abandoning of female partners, abandoning of women and wives, and polygamy. These are rising, and there are also risk of trafficking. So we know that this research mostly focus on, in retrospect, we wanted to hear from the health service care providers about the patterns of violence that the Rohingya population experience. But we also need to now give emphasis on how these, changes are happening, and if we are, able to provide the related and necessary services. Thank you.
Thank you, Shanur. appreciate the focus on that we heard from some of the health professionals. Again, while women and girls certainly are the core victims here, but the issue of men, boys, and gender fluid individuals is really important. And I also appreciate the focus that you brought on sort of the spectrum of violence, right? So the violence continues, and maybe that links with what Yasmin said before about a traumatized existence. And how we can't just look at the past, but we need to look at the present and the future. And so looking at that, kind of going outside of the immediate health and mental health impact, I want to bring the next question to Akila, who can, I hope, help us kind of put this in context and how you position this research and these findings within the broader body of literature, of evidence on gender and sexual-based violence against the Rohingya, and how does this complement other findings, and how do we use that in the future for accountability?
Great, thank you so much, and thank you for having me. You know, I think there's a couple things here, and you know, one of the things that we have to start with was when the outbreak of violence happened, there was kind of a rush to document. There was kind of a mass mobilization to say, we need to get people to care about this. And there was a rush of documentation. And, you know, as several of my co-panelists, including Yasmin and Lindsay, have alluded to, primarily based on witness testimony. And, you know, what this did result in, especially because of the relative open and ease of access to Cox's Bazar, was a crisis of over-documentation, which had a couple of different effects that I think are important as we think about what we have there. You know, both first and foremost, I think, and has been highlighted by multiple of you, re-traumatization. So really the way that witness testimony was being taken for a purpose, and let's be clear, at the beginning, it wasn't being necessarily taken towards a preservation and a focus on justice and accountability. It was being taken because there was an immense humanitarian need. There was a real need to try to spur action. And I think, you know, documentation and stories are one of the tools that we have for getting people to care. You know, it's and people like Yasmin can tell you that it's not for lack of trying that the Rohingya, you know, the situation of the Rohingya that has gone on for decades has not been paid attention to by the international community. And so I think that was one component that was going on there. And the other part of the over documentation, of course, especially as it relates to justice and accountability, is that it has the potential to corrupt the evidence as people are being asked the same questions over and over. You know, the stories can change, the testimonies can change. So I think that, you know, in the beginning, there was a lot that was honed in on kind of the, you know, people who were immediately fleeing. Also, you know, testimony that was being taken perhaps without adequate training around sexual gender-based violence. And, you know, as Shannon has pointed to, referral pathways for trauma care and a range of other support services that probably needed to be provided. And so I think that, you know, this report kind of comes in and complements a lot of what's been done. Obviously, the fact-finding mission for Myanmar established by the UN, once they were established, did a really fantastic and thorough job of documenting the crimes that occurred, you know, in 2016 and in 2017, and really, you know, kind of gave that comprehensive outlook. But I think here, by focusing on something that I know PHR has long done, I know this is a part of the work that you've done in Congo, for example, is to work with medical providers to provide this other type of information that can corroborate the witness testimony, that can be utilized as expert evidence in court proceedings. I think it really adds something that is a bit unique to this whole process of documentation. I also think it helps us think as we move forward in these moments about, you know, who are the people that we talk to? What do we do when, you know, when we have these competing prerogatives, especially at the outset of a crisis? You know, you have this need to get people to care. You have the need to raise immediate funds for humanitarian services and establish protections. And then you have, in the longer term, most likely something that needs to be laid for justice and accountability. And so I think that, you know, there are many things to be learned, you know, to kind of, I guess, make it a bit more clinical from the way that the process of documentation happened in the Rohingya crisis. And I think we should be deeply reflective of that, especially as it came to sexual and gender-based violence, and make sure that as we move forward as an international community, that we think about what are the ethical practices, what are the practices that we're making sure that, we kind of do the work in a way that serves the needs, doesn't, and the other thing that I'm always struck by is especially these days around this focus on sexual gender-based violence, is what I would call trauma porn. So much of what we've seen has been that the stories of the women, particularly in this case where you have mass gang rapes and statistics, they tend to be used to sensationalize, but they don't tend to be used to inform responses. They don't tend to be used to inform the strategies. And I think that, it's also really important that by bringing in people like healthcare workers, you can kind of take a little bit of that sensationalization away, and focus on the real needs. So I think I'll stop there on this question, but I know there's a lot more to talk about when it comes to justice and accountability.
Thank you so much, Akila. Yeah, I mean, I think you described well the tension between the need to document, but the need to be very ethical and survivor-centered and try to not harm survivors. And I don't know, Lindsay, if you would like to chime in here about the ethical considerations as we designed the methodology for this study, but also a conversation that we all had in the research team about the health providers themselves who were exposed to what Akila called the trauma porn. I mean, it's what people gravitate towards, but whether, obviously, if you're a survivor, that's one thing, but if you're the person who is taking in that information, that can also impact you in profound ways. Lindsay, do you want to comment on that?
Sure, I'm happy to do that. First, to your first question, Ranit, about just the ethical considerations in our research design, I think this is something that we thought about a lot. And we went into this research project with these research questions and aims, knowing that we did not intend to speak with survivors. So I think that required a lot of creativity. But I think as my other panelists have mentioned, I think it lends itself to some very rich data that hasn't been shared elsewhere, because the healthcare workers we spoke with have this individual patient and broader population level perspective that I think can help us to think about not just the individual survivor stories, which are so important to document and to share, but also, as Yasmin so eloquently put it, the community level trauma and ongoing health effects that have not been addressed. So I think in those ethical considerations for how we are going to approach this research, I think taking the possibility of speaking to survivors off the table and thinking about PHR's unique perspective and our unique lens into the medical community, it lent itself very well to this type of research. And I think also this qualitative inquiry that allows for, in the case of Ranit or Shahanur, to have a conversation with a fellow practitioner to be able to speak on that same level and then document these stories. And then in terms of the second question related to just the mental health and the re-traumatization or vicarious trauma of the healthcare workers themselves, that is something that we asked about, and we have additional data about that we would love to spend some time going into at a later point. But I think overall, the stories that resonate with me the most is when we think about the provider workload and just the chaotic care environment that impacted Rohingya survivors and also impacted the healthcare workers that were trying to provide them with care. In the report, we speak more about also just the long-term lack of access to health services that Rohingya survivors faced in Myanmar. And many health workers not only felt overwhelmed by the stories they were hearing, by the survivor experiences, but also many of them said, like, I think I'm the first doctor that this person has ever seen in their life. So just the long-term impacts of that denial of health over generations, and how that for healthcare workers felt very overwhelming. And just, seeing 80, 90, 100 patients a day, having a triage room full of people who all need healthcare, who are all sick, who are all traumatized. I think for healthcare providers, that was very difficult. They shared that having community of other healthcare workers really helped with that, being able to debrief after. But I think it is an area that we at PHR think about a lot for our own staff, but it's an area where there's much more discussion that's needed about how you support not only survivors in their trauma, but also healthcare workers.
Thanks, Lindsay. I want to kind of fast forward to today, and of course, some of the questions are addressing conditions in the camps today, especially in the context of the coronavirus pandemic, which we can't ignore. It's a huge elephant in the room, and which is affecting the population in Cox's Bazar, and really all over the world, but particularly in the context of refugee camps, enormously. So I wanted to maybe take this, ask Shanur, what do you know right now of what is happening currently in the camps in the context of COVID, but also in the context of internet shutdowns by the government and the ability of the refugees to communicate with the outside world? And maybe Shanur and then Yasmin can take that as well.
Thank you, Ronit. I had an opportunity to, go to Cox's Bazar a few weeks ago to do another round of interviews with different healthcare providers. We know that the camps were locked down from 24th of March, and it was locked down until recently in August that the restriction in movement were little bit flexible. And in the beginning the government actually divided the services in two parts, like essential services and non-essential services. And unfortunately, the protection related services or HGB related services were put in as non-essential services. And there were very limited amount of services that were provided at that time during the pandemic time. And there were restriction of movement of the staff who provide day-to-day protection related services to the Rohingya community. So after that, I mean, that put a lots and lots of pressure to the service providers, not in terms of providing care services, but also in terms of like when they know that there are clients, there are people who would come to them for receiving the services, because the needs are never limited, but they cannot provide the services. And there was like the mobile connections, the 3G, 4G connections were also stopped long before pandemic. But then that put another hurdle for the service provider to provide the telephonic or telemedicine or services through telecommunications. And the referrals were also disrupted. Like usually what happens when a service provider gets a patient or client, it's usually happens that the staff accompany the person to the organization, or they immediately contact another relevant organization. But at the pandemic time, it was hugely disrupted. And now what I found a few weeks ago when I went there, I mean, the HDPV services are now giving flexibility. So more and more staff are now going to the camps. And although the government, leave the restriction of mobile connection for certain time, in Cox's Bazar told me that, that will again be, how do I say, that will again be imposed on them. So, and during this time when, the many humanitarian workers are not in the camp, the pattern of violence has also changed. We know about, protection from sexual exploitation and abuse, PSCA. PSCA has increased. Like the development workers, unfortunately, they're abusing the service recipients, because, in normal times, they would think twice to, abuse the other recipients. But when there are not many humanitarian workers in the field, so they took this opportunity. I heard this, I mean, I can say that as an anecdote. And very recently, there were some violent clashes between, 2-3 Rohingya rebel groups. And unfortunately, quite a good number of persons died in that. I mean, they were shot dead. So that was also very critical at this point. And I mean, the humanitarian workers are now, they're increasing the number of staff who would go to the camp and provide the daily services. Now things are becoming normalized, but I wouldn't say that it's as, how do I say, well systematic as it was before. And also, most of the funding are now focused on, pandemic and COVID services. So in terms of donor funding, I mean, this is also cut down.
Sounds incredibly complex. I want to give Yasmin an opportunity to talk about, what do you hear as an activist in the Rohingya community about what's actually going on right now in the communities of Rohingya in Bangladesh?
So apart from what Sharanur had mentioned about the violent clash, that alone actually displaced over 1,000 people. Majority of them are women and children, and people of disability. There are a lot of issues around essential services being cut from April onward, and since then we now understand that some of the foreign aid workers have been, asked to leave, and thus the reason why there is less essential services that are being given to people. Some of the camps actually for the past few months have ran out of water completely. A lot of people that I've talked to, a lot of those that I try to help however much I can through my own various different, unofficial fundings that come from donations and friends and family, go to people who actually cannot and have not been able to access food distribution. And the food distribution actually involves a lot of steps, and you have to go and line up for the bags of food. Families have not been able to feed themselves properly for the past few months, and this extends to today. A lot of issues around information being distributed, especially the life-saving, information about COVID-19, has not been as effectively distributed because of the lack of communication and the rumors that are spreading. People are already fearful of healthcare workers as it is because of their pre-existing fear that precede them being in Bangladesh. They were already in fear because there was a lot of accounts of abuse inside Myanmar that they've experienced or someone that they know experienced. So this was a huge, tremendous, task that they would have to get over that themselves, the feelings of fear. On top of that, they do not understand a lot of the basic understanding around how risk factor works and how people with COVID-19 should be it could be prevented, or that it's actually not a disease that can be repelled by reading the scripture. There's so many different kinds of rumors that are going around. Some of them are helpful, some of them are not, and that really prevented people from being able to really adhere to the preventive measures that will potentially stop the spread, or at least help the authorities and the people who work in the camps to manage the situation. Apart from that, the internet connection, I think, was reinstituted, but a majority of people do not have money. How are they going to be able to afford a cell phone when they don't even have money to buy food for their children? So that's a huge, huge drawback from, us celebrating at one point that the internet has been reinstituted, and it's awesome that people are now going to be able to have access and communicate with each other. It's not as easily done as it seems. And on top of that, a lot of the civil society groups that I've met personally in February have then been asked by a lot of aid organization who does not have the capacity because they are understaffed to actually go door to door to distribute masks, to do a lot of the work, the legwork that they're not able to do without being paid. So that's another drawback of people not feeling like they have autonomy over their lives. So the violent clashes that it is happening right now is actually a byproduct of all of the restrictions that they've faced, not just in Bangladesh, but from, you know, living inside Myanmar under persecution for years and years, and now in a safe place, but also they don't feel like they have control over their lives. A lot of the women that I've spoken to during my visit in February, they were talking about how they were going to band together to actually help women surveil around the areas that are hotspots for human traffickers to actually kidnap women. They're not able to do that since the lockdown. And a lot of the, you know, potential help that could go into helping them being able to, you know, basically manage and group women together to actually go and into squads, you know, accompany each other to do the task, to just, you know, live their daily lives. It is not, it's not as much a reality now as it was before. So not just the mental health support that they are needing, but also the one of the most basic daily lives, the necessities, the food, the water, none of those have been addressed largely.
Thank you. I mean, of course, the conditions seem absolutely atrocious, and it's such a complex situation, which kind of makes you think, and this is a question for Akila, you know, there are all kinds of voices from within Bangladesh and in the international community talking about relocation or repatriation. What are some of your thoughts? What are the threats? What are the harms and potential benefits of doing something like that? And how can it be done safely and with the consent and support of the community?
Sure. I mean, I think that, you know, if you listen to the Rohingya, they've made it clear what the conditions for safe voluntary repatriation look like. And, you know, and actually justice and accountability is one of them, right? Because how can you expect people to return back into the hands of their perpetrators in a situation that has not been secured? How can you expect them to also return back to a situation where none of the structural factors that resulted in their longstanding discrimination that enabled the violence to happen have been addressed? And so I think there's this, you know, there's this massive tension right now between the need to essentially resolve what feels like an unmanageable humanitarian crisis. You know, there are immense burdens on Bangladesh, but that cannot then be subjugated, you know, cannot subjugate the interests of the Rohingya and what it will take for them to safely return home. And so I think that component, there's, to me, you know, in the time that I've spent talking to Rohingya activists, community leaders, it's eminently clear what they are looking for. And yet the international community kind of seems to keep choosing its own definitions of what are the things that are going to make a community that has been so deeply traumatized feel safe again. And so I think that the first thing and foremost thing is to really center this back on and listen to the voices of the community and what they are saying. And I think that's what's going to help us understand what repatriation efforts can look like. Because, you know, Yasmin can speak to this far more eloquently than I can, but, you know, they're just, you know, there's this sitting in New York, sitting in these conversations, for example, around the Rohingya and what to do. You know, it's so easy to say, well, all you need are, you know, these kind of bare guarantees that will then allow them to go home, and then it's resolved, and then it's up to Myanmar to figure it out. Well, that's not really any sort of sustainable or long-term solution. And so, you know, and I think that in particular in the conversations around Myanmar, justice and accountability is a really tricky one because the government is so, you know, finds it to be such a confrontational topic. And yes, it is confrontational, but that doesn't mean it doesn't need to be addressed. And there is a large swath of the international community who says, well, they need more constructive engagement, so we do not push them on the things that are not useful because the first priority is safe and voluntary repatriation. Well, if one of the preconditions for safe and voluntary repatriation is justice and accountability, then I don't really know how we're going to move forward on this conversation if it continues to be ignored.
And one of the other questions was specifically about relocation. You know, there's been talks about relocating the population to an island off of the shores of Bangladesh. Yasmin, I wonder if you want to take that question.
A really, really difficult one. The issue around Bhasan Char is an infrastructure that is already built. Bangladeshi government have put so much effort into it. It was actually, you know, specifically the Bangladeshi Navy that had, you know, put the projects together. And apart from the internal complexity within Bangladeshi as a nation state, it is important to note that the country is trying their best to ensure that there are, you know, there are enough support and enough resources for the refugees to not have to suffer, and also to sort of, you know, remain inside the country for as long as they need before they, you know, repatriate back. The problem with the island as a whole is that it lacks transparency. And there have been several reports by, you know, Human Rights Watch and Amnesty International around the sexual and gender-based violence that transpired within the Bhasan Char Island. And it opens the ground for us to actually view this from a lens of re-victimization of the survivors. It will happen at some point, and it already happened in a lot of cases of the same women that have gone through, you know, sexual and gender-based violence, especially mass rape victims, who have then become trafficked. You know, sometimes they do that for money, sometimes they were, you know, taken against their will. It is it is dire for the international community actually to ensure that Bangladeshi authorities, the government, the entities that are involved in essentially helping the Rohingya remain inside Bangladesh in safety, that they feel secure, that they feel assured that the fundings or the sort of support that they need, not just today, not just 1 year from now, but 10, 20 years from now, will remain. The same kind of commitment that the, you know, various different governments, specifically, I'm talking to my Canadian government now, the $300 million that the Canadian government actually committed to help support the various projects and programs inside Bangladesh, there has not been a renewal of the commitment. And I get it that the, you know, issues have been basically really, really relevant at some point, and there is a short attention span to a lot of these issues due to the complexity and bureaucracy and so many other, you know, international interest and all of the other factors. It is so dire that refugees are viewed as humans that are worthy of helping, as humans that are, you know, as worthy as anyone else in other regions, specifically in the Western Hemisphere, and without valuing, you know, refugees in the same ways that we would value a citizen of Canada or a citizen of the US or a citizen of, you know, somewhere in a country in Europe. Without having that mindset, it will be almost impossible to be able to assure that Rohingya actually enjoy the life with the, you know, human security that we need, the various different factors of it, especially food security, especially education, especially the things that will help people feel like they have autonomy over their lives and look forward to contribute to the society. These are, you know, not just victims of violence, but they're also, you know, a huge opportunity for the international community and for Bangladeshi government to look at these as human resources. But we're not willing to shift the narratives at this point. And what it does is it actually further the sort of pressure that goes onto the international community and basically produce the donor fatigue that we see today. So I know I've actually come really far from Bus Char topic, but I just wanted to paint a different picture and help people understand that yes, Bus Char is not an ideal place at all, and the 306 people that are currently being held there, I'm not going to say that they're living there, but being held there, should actually be released into the Cox's Bazar refugee camps to live with their families and to be helped there rather than out of sight, out of mind. Thank you.
Thank you. So yeah, go ahead.
Add something here quickly, because I think this really is important about what Yasmin is saying. Also, by fact of being refugees, you don't lose your human rights. All of those fundamental rights that need to be guaranteed to you, right? As a matter of this fundamental framework, you don't lose them because you become a part of a refugee or an IDP community. And I think that we've sometimes disassociated ourselves from this rights-based framework that needs to inform our responses, right? So, when you think about Bas and Char, when you think about the internet shutdowns, when you think about, what Yasmin is talking about with right to education, adequate, food security, those are all things that need to be informed by this larger human rights framework. You don't get a lower standard of human rights or your rights just because you're a refugee. And I think we've really oftentimes stepped so far away from that concept or that framework just because we expect people to be grateful for whatever we're able to give them. And that is just too low of a bar that we're operating under.
Right, and this is a point, of course, as Yasmin made, that it's not just unique to the Rohingya refugees, but the idea of acceptance and the basic dignity of humans, regardless of their legal status, is critical all over the world, in essence. So thank you for bringing that up. I wanted to go back to a couple of questions in our chat, and I'll perhaps give the questions to Shanur. Our report specified that there are specific populations that are very vulnerable, including transgender communities. And so we have a question from one of the attendees. How do you address transgender people inside the camp? And also, are they staying in the same camp or are they scattered? What is the culture in the host community in Bangladesh about transgender people? And I also want to link that with the general question about what is happening right now in terms of the provision, the resources available to these marginalized communities related to mental health and services and SGBV services.
Thank you very much, Ronit. As I told before, that now, the humanitarian workers or the humanitarian community have realized or understood the needs of this vulnerable group of populations. There are few organizations, I can name one, like Bondhu Social Welfare Society, who has been working in this group of population for decades in Bangladesh and working in the areas of their rights and awareness and service provision. So that's one big organization that is working in the camp, but that has not started quite earlier. It's only in 2019, I remember, that they started to, operate in the camps. And in some recent, rapid gender analysis and some, gender reports in Cox's Bazar, the research that was carried by different humanitarian organizations, they are bringing this issue of transgender population. And as I told earlier, that the services are not, like universally provided to them. And sometimes like they come to the center for men and boys to receive the services, because there is still huge stigma in their community about the transgender population. And in some of the, quotations from Lindsay's presentation, and those are in the reports, that they were, they experienced different forms of violence in their own community in Myanmar, and they're still experiencing that in this country. Like they have been used as, to perform the sexual activities by their own community members. So it's a very, critical issue to look at, but I would say the organizations have started to, address their needs and started to provide the relevant services. And when you ask me about the host country's, mindset or perception or attitude towards this population, you know that the government have now recognized transgender and third gender, although I have problem with the term third gender, besides male and female. So in general, in Bangladesh community, we are much sensitized about, the transgender population. I wouldn't say we are same sensitized about other people of different sexual, orientations like gay, lesbian, etc. So there is this positive mindset among us, and we are trying to perpetuate that in the Rohingya camps. But I'm positive about it. Thank you.
Sounds like there's some hope, and there's always room for improvement, but it sounds like some basic steps are being taken both at the Bangladeshi government level and perhaps in the camps as well. I wanted to take another question from our attendees, and Lindsay, I'm going to give that question to you, and I'll read the question as stated. Given the risk of re-traumatization and further complicating the mental health situation, how do you address the need of revealing the situation through a survivor-centric approach? And I know we touched upon it, and this was a topic of conversation for us, and there's this tension between speaking to survivors and not speaking to them, but still telling their story in a comprehensive and truthful way.
Thanks, Ranit. That's a great question. A few initial reactions. I think first, there is always the possibility of speaking with survivors, and I think as our healthcare workers that we spoke with revealed, for some survivors it can be very cathartic or very helpful to be able to share their experiences. But it needs to be done in an environment that's supportive, where there's appropriate support during the interview or during the opportunity for survivors to share their experience, and also afterwards. One thing that we emphasize in this report and that we saw a lot is that long-term mental health support, not one-off sessions, is really needed. And for survivors, especially who are sharing their stories, and as researchers speaking to survivors, I think it's on us to make sure that those services are available and that we are able to provide those services or provide access to those services for survivors. I think also taking a survivor-centered approach in research on these topics really, as I said, it's required that survivors guide that experience. So there's a lot of different research methodologies that participatory action research, where survivors themselves define the questions that they want to answer, define the way that they want to answer those questions. And I think using those methods can allow that experience to be empowering, can avoid the risk of re-traumatization. Also, I think taking mixed methods approaches and using different sources of information to reach saturation or to reach kind of that point of having the stories all align. So not just putting the burden on survivors to tell their story and then to make sure that all the stories line up, but using survivor stories, using the perspective of healthcare workers, using medical records when they're available, using a mixed methodology to corroborate or to gather that information, I think is really an approach that can be used to lessen the burden on survivors and also avoid re-traumatization.
Thank you. And so I think we have about 15 minutes left. And I think what I'd like to do for the remainder of the time is think about how this project, the data that we've collected and data from other projects that PHR carried out and others, thinking about the collection and documentation, how it helps with moving forward with justice and accountability. Maybe I'll start by asking Akila, there are all kinds of new mechanisms, the IIM, there are old mechanisms, ICC, ICF, ICJ, and certain governments who are taking the lead, like the Canadian government, Gambia and others. what needs to happen moving forward to make sure that this situation, that the story of the Rohingya, that what happened to them, that these atrocities don't disappear, don't continue to be, you know, part of in the news and part of the discussions among international organizations?
Great, thank you. So this is something we spend a lot of time thinking about, especially as it relates to justice and accountability for sexual and gender-based violence, because, you know, going back to an earlier point, what often happens is that these stories are told, but when you see and find the endpoint of justice and accountability, the experiences of sexual and gender-based violence, and primarily those of women and girls, are left behind. They're left behind because prosecutors don't understand them, investigators don't understand them, those who are putting these cases together don't know how to put this evidence together. So that's something that's been a really big project of the Global Justice Center, is really to think about how in all of these various accountability initiatives, sexual and gender-based violence can be centered and really thought about as something that, because it was so integral to the way that this genocide was carried out. And I think that, you know, reporting like this is immensely useful in terms of corroborating what we already know. And I think, you know, one other thing that I've been thinking a lot about this year is at the domestic level, there's been a very specific campaign by the Myanmar government to deny specifically the acts of sexual and gender-based violence. So domestic investigative mechanisms like the the Independent Commission of Inquiry that the government set up, you know, they admitted to kind of a limited set of violations that may have occurred and categorically dismissed rape and sexual violence. To the CEDAW committee, the government has called all claims of rape wild. And at the ICJ proceedings, they entirely ignored the context of sexual and gender-based violence and refused to address it whatsoever. And so I think that, you know, one, there's something in there as to why this particular type of act is something that Myanmar's government is currently saying absolutely did not occur. And we cannot allow any of these domestic conversations that are being led by Myanmar, we cannot allow them to erase these experiences. And I think that's one thing that at the domestic accountability level where, you know, whatever is going on, that needs to be thought about, because you can't, if you have continued impunity for sexual violence, and we know that this is something that Tatmadaw has done against all ethnic groups, by the way, in different ways and different scale, but, you know, sexual violence is something that they systematically use as a weapon of war, and ethnic women's groups have been documenting this for decades. So that's one piece. And the other piece is really to make sure that there is serious thought to what it means for sexual and gender-based violence to be included, for example, in a case at the International Court of Justice, because the jurisprudence there on sexual violence is quite thin. And, you know, most of the conceptions of genocide are around killing. And so while you have these limited cases that have come out of Rwanda and Yugoslavia on genocide, you know, especially the strain that comes out around Akiyesu, we've actually looked at the results of the legal jurisprudence. It hasn't carried as far as it should. And it's also been very narrowly focused on one specific subset of crimes, rather than to think through how it informs genocidal intent, how it informs the way that, you know, all four of the crimes of genocide that have been documented actually had a gendered perspective. And so I think that the continued focus on sexual violence, the continued understanding of the broader context of it is really important, because that needs to inform whether it's at the ICC, the ICJ, or in domestic cases. And, you know, I consistently worry that we are still going to hear the stories of women, and ultimately when we get to the endpoint of all of these, justice is not going to be rendered for them.
Yasmin, what is your thinking about what's going on, and what is the role also of the Rohingya population outside of Southeast Asia at the moment, outside of Myanmar, outside of Bangladesh? I know that there are pockets in multiple parts of the world. What do you see as your role in trying to further justice and accountability?
I think the best thing that we could potentially do is to not stop making noises. We also would need to conceptualize some of the ways we could help our own population not just within the context that we see, not just within what's perceived right now, but further, how do we place ourselves into various different organizations that are currently helping Rohingya? How do we equip ourselves with enough, knowledge? And some of these, roles and titles might actually require us to have a university degree, or to have a law degree, or to have some sort of a professional qualification in order to pursue that. There are a bunch of young people that I've gotten to know in the past year or so, and it's really encouraging to be able to see that they're becoming young professionals. They're studying in university. They're first generation immigrant refugees, and they're making their ways into the world. But I also emphasize in a lot of the meetings that we usually have together that you will not be able to help your own people as well as trying to go into the jobs, go into the professions, go into actually pursuing some of those titles, some of those professions that will essentially catapult you into the field, working in the UN, working with the IIMM, working for various different international legal mechanisms. We should have our own people in there in order to be the brain to think for the system, because right now the system is not made for us. It is not made for the minorities. It is not made for a lot of people, especially women, especially people, outside of the binary gender and sexual construct. So without being able to do that, the long-term goal will never be met. As long as we continue to make noise and realize that that is going to be our role and something that is going to be needed in order to rebuild this community, from the top, not just waiting at the bottom for the fundings, for the breadcrumbs, and do whatever we can with those breadcrumbs, while at the top there are $300 million from one government, there are $100 million from another. Where are those money that could potentially save human lives? And so without being able to have that access to the fund, not directly, but in terms of decision making, I don't think that we're going to go very far from the current situations that, the constraints that we often feel as the diaspora or the people, social agents on the ground that are trying to do the work, but are constantly being interrupted. And the disruption that are felt is, first of all, financial, and sometimes it comes from the, political complexity that comes with allowing us to have our own voices or have our own autonomy. So yeah, that's going to be really important. But I'm really glad that I want to actually even emphasize what Akila just said. It is so important to us, to the Rohingya, as I said earlier, that it validates our experience, but it also abruptly disrupt the narratives that the civilian government have actually put out with the ICOE report, categorically denying that sexual and gender-based violence never happened. Aung San Suu Kyi in the ICJ, she never even mentioned a word of rape or a word of sexual violence inside the court itself. But also largely within the population inside Myanmar, the Burmese people, the ethnic communities, especially the Rakhine brothers and sisters, that we're trying to branch out and reach out to them to build this solidarity. I'm doing this with some of the youth groups in Myanmar. They're often being told, that the international communities are ganging up against the country, but the government has been super smart in pushing the narratives into blaming the entire nation, and pushing the narratives that no, the government has done nothing wrong. They're trying to target you. They're trying to target the citizens. They're trying to target the lay people. And that has been the constant, I think, constant reflection of how the government have had a really good handle on the propaganda and have affected the ways in which people interact with, the news of genocide, the news of various different issues. Even the Rakhine youth that we talked to at the beginning, they were in complete denial of anything happened to Rohingya. Even at the time that there are so many reports coming out that the military have been using children, Rohingya children, as artillery shelling or shielding them from the fights. So all of this comes down to the countering the narratives that the government puts out, not just directly because of their report, but also help us to be able to use the accounts that does not come directly from the victims or from the survivors, but a corroborated narratives, a corroborated perspective that comes from the doctors, from health professionals, to be able to show it to the to the citizens, to the people that we might be able to eventually build the bridge with, and say, here, look, this is the actual professional opinions of what had happened. If you don't believe us, look at this. So it's really, really important. I really want to applaud the work that PHR has done. I will stop there. Thank you.
Thank you so much. And before we finish, Shanur, very briefly, what is the role of the Bangladeshi government in accountability and justice for the Rohingya?
It's a very tricky question for me to answer, but what I have, hearing and reading from the newspapers, even very recently, the Honorable Prime Minister, she actually, asked the government of Myanmar and the international community to help us to sort this problem. Like, we agree or we don't agree, I mean, this huge number of population is honestly a burden for us. Like, how far can we provide the services? How can we provide the basic necessities when it is the time that, like my other respected panelists also told, that the donors are not supporting or stop supporting, providing the donations, for working for this community. So it's a difficult situation, and government is providing, as much services as possible to this community with the help of, international community working in the, in the camps. But as well, we're trying, to push the agenda for repatriation. But I don't think I'm in a position to, tell more about, like the government's position. But before I conclude, if you allow me, I'd like to flag two more issues. Like Lindsay earlier mentioned about, in responding to one of the attendees on survivor-centered approach, I would say in practice in the camps, I mean, that the intersector coordination group works closely with the government in provision of any kind of services in the camps. But I would say when we talk about SGBV or survivor-centered approach, we don't always speak the same language. For instance, in the pandemic period, it took the ISCG almost 3 months to make the government understand why SGBV service is an essential service. So that's another thing that we need to, aware the government as much as possible to understand, these ethical and these issues. And I want to speak for the humanitarian workers themselves. Honestly, in the camps, the Rohingya population live in the uncertain times, and we are also living in uncertain times. We don't know when, where is the end? I mean, all of the humanitarian workers are like burned out. They work 24/7, and there's no end of it. The needs are growing every day. The needs are, changing shapes every day. So I'd request the organizations to also look at their, the mental health care of their staff, or look at the staff care. So that's another important thing. Thank you.
And it's very, very clear that there's so many constituents that that have to work together, from, as Shanur said, the humanitarian workers to physicians and health workers to lawyers and international human rights experts to obviously human rights investigators and civil society organizations like Physicians for Human Rights, and ultimately advocates and Rohingya individuals themselves. So thank you so much for your incredibly important perspectives, and hopefully we will, the next time we talk about the Rohingya population and their current situation, we'll have some incredibly, or some better news to share about justice, about accountability, and about self-empowerment. Thank you so much to everyone who tuned in today.
Thank you so very much.
Thank you.
Thank you.
Thank you.